Hi, Dr. Jessica. Oh my God. Where are you
Hi.
there? Is it you are in the some foreign country now?
Oh, yeah, I'm in Portugal. I'm at the World Meeting for Sexual Medicine with the International Society of Sexual Medicine. So it's really exciting. There's a lot of really good research being presented. It's really fun.
Oh my God, you are everywhere. Whenever I see your social
Yeah.
media, you are in the all different meetings and conference. I'm so happy to have you here and then share your
Oh, thank
knowledge
you
with
so
my
much.
audience.
Yeah.
Yeah.
It's
So
my
let's.
pleasure. I
Oh,
love talking to you. It's been awesome. Yeah.
thank you so much. So can you briefly introduce yourself, Doc, for us?
Yeah. So yeah, I'm Jessica Yee. I'm a urologist by training, and I did a sexual medicine fellowship with Dr. Irwin Goldstein. And so in my fellowship, we studied both male and female sexual medicine. I also did a portion of my fellowship with male infertility with a specialist in male infertility. So I do microsurgery and other male infertility treatments as well. And then now I am at University of California, Irvine in Orange County. So it's been great opening my practice here and really kind of getting to know the community here and treating my patients here.
Yes, because since our clinic just specializes in infertility, absolutely
Yeah.
there's a lot of a male side. But one
Yeah.
reason I really wanted to hear about your opinion is like a sexual health, because that's why you are in the meeting there, and then there's a lot of people's interest, but very still confusing. So
Yeah.
let me start asking you about this. So many people, when they think like a sexual health, just means
Hmm.
like a libido, is like a more like a sexual desire. But from a medical perspective, and what actually defines healthy sexual
Yeah.
function for both women and men?
Yeah, I think we have to think along the whole spectrum of what happens during sexual activity. So, libido may be just the start of it, so you have a desire for sex,
Mhm.
but then there's also arousal. So there's both physical and psychological arousal. So physical arousal is like you get lubrication in the vagina, you have engorgement of those tissues because of the increase in blood flow.
Mhm.
And then, of course, we also have orgasm. Right. So many women have difficulty with orgasm. So that's a big part of sexual health. And then also having resolution. So some people have this condition where they have orgasms all the time, and some people don't understand this condition. They make a joke like, "Oh, that's so great," but actually, it's very bad. It's very, very distressing situation. So that is a lot of the sexual health conditions, and then of course there's sexual pain conditions. So if you have pain with sexual activity, of course that's not going to be a good time for that person, and it's really distressful for patients.
Yeah, because actually we had a couple patients coming with those like too much, like they have a little bit of a, even like addiction, and then they try
Yeah.
to get help, and then the pain, and we see a lot of pelvic floor issues. So there's a lot of
Yes.
pain involved with the endometriosis, and it's such a complex. I think it's
Yeah.
patients are going through in these challenges. So since we are in here, like, our recording right now, 2026, there are so many thoughts and opinions about the hormones and then
Yes.
menopause or perimenopause
Yep.
and even andropause. So why do so many people have these changes in libido? And then when they age, like especially as I said, that those specific, the female or male, like menopause and andropause, and what's happening, and then hormonally.
Yeah. So it's many different stages of things happening with hormones and libido. Some of them match and some of them are a little bit mismatched. So testosterone is very important for a woman,
Mhm.
right? Many people think testosterone is just important for men, but it's also very important for women. But for a woman, the testosterone actually starts going down many years before menopause, even before perimenopause. Actually, testosterone starts going down in the mid to late 30s. So we see some decline in libido during this time, and then there's sort of a stability through menopause, and even sometimes a little bit of increase in testosterone after menopause. But then libido sometimes can decline related to the decline in testosterone, but then it can also be related to like GSM. So GSM is genitourinary syndrome of menopause. So that is something that happens with the decline of estrogen. So you can have pain, vaginal pain or dryness, and having pain, of course, will decrease your desire for something, desire for sex, right? So you can have this decline in libido related to just these symptoms of vaginal pain related to menopause. Um,
Mm.
so there's multiple things going on within this time of premenopause, perimenopause, menopause, postmenopause.
Wow. So this is a little bit of a side note. I'm kind of also curious too, because it's a personally in the you are urologist and then
Yeah.
sexual medicine. Can I ask you and why you're interested in this medicine? This is a kind of
Oh,
yeah.
yeah.
I'm kind of it's very personally. I was very interested because you are young and is there any specific reason you are interested in this sexual health? Is some story behind?
Yeah, I had a very good sex life in my 20s, and I met my best friend in medical school, and we were both like 22 or something like that. And she became my very close friend. And one day she told me she has so much pain she cannot have sex. And I thought, wow, I've never heard of such a thing. I thought everyone loves sex like I do, but she cannot have sex. She doesn't like it. She doesn't want to do it. And this was during medical school. So I said, let's go and see what we can find out. It must be in our medical textbooks or something. And so we tried to look for some information, maybe what her diagnosis is or what the treatments are. And all we found was just two lines about vaginismus. And so we read this vaginismus is like kind of a psychologically related condition where a woman will close her legs very violently or something like this. And then there was no information about treatment or anything because they just said, we don't know how to treat this. So I was thinking about this and, I thought, how is this possible that we cannot know anything about this condition, right? But because we didn't know anything, I didn't know what to do. So I just, we let it go. She had a relationship, but she didn't have sex with her partner at the time. Um, and I went on to do a urology residency, and I always thought about her in the back of my head. I thought, what can is there something I can learn to help her? But even in urology residency, I didn't learn anything about women's
Mm.
sexual health. I learned a lot about men's, like erection issues, Viagra, penile implants, but nothing about women's sexual health. And then finally, I just by accident almost met Erwin Goldstein. We call him
Mm.
kind of like the father of this field of women's sexual health. I met him at AUA, the American Urological Association meeting, and he presented his research and his clinical practice, talking about the female prostate, female ejaculation, orgasm. We mentioned the orgasm problem in women who have too many. It also can happen in men, but that's called persistent genital arousal disorder. So all of these things just blew my mind because I thought finally there's somebody who can teach me. And so then the rest is history.
Wow, what a I mean that is actually a wonderful story because it's especially you saw the suffering of your
Yeah,
friends, and then
yeah.
there's a no answer, and it's a
There was, yeah,
lifelong sentence, and then that is horrible. So in our
yeah.
clinic, we see a lot of endometriosis patients.
Mm,
And then, because
yeah.
since you mentioned, like when we talk about this sexual health, we are talking about the more emotional and then how we can have a more better
Mm,
sex. We think that's what it is about. But you mentioned no, we actually talking about pain.
mm-hmm.
So
Yeah.
when patients, like, because I'm trying to understand, the cause of endometriosis and then what kind of a treatment involved. So it sounds like you also see a lot of patients with maybe like a silent endo or even non-endometriosis patients as well.
Yeah. So I think there's a lot of physical causes of sexual pain, right? We used to
Mhm.
think it was just, psychological or anxiety or, drink a glass of wine, you'll be fine or something like that, right? But there's so many different physical causes. Endometriosis is one of them, right? You mentioned pelvic floor dysfunction is another big one. We're learning more about pelvic venous disorders or like pelvic congestion syndrome. There's also inflammatory conditions like people used to think about vulvar vestibulitis. We don't usually use that term anymore, but that was that was the theory before. And then now we have these two vestibular conditions we call neuroproliferative or hormonally mediated vestibulodynia. So either you have this pain in the vestibule related to hormone deficiency, or related to maybe something congenital, even some inflammatory condition that was maybe even congenital or congenital to the tissue itself. So there's all of these different causes, and there are many more actually that I didn't say, but endometriosis is one of them. But because there are so many different conditions, we have to take a multidisciplinary approach. So as a urologist, I actually don't treat endometriosis, but I treat some of the other conditions. So if when I screen patients, I ask different questions, and when I talk to someone and it sounds like they may have endometriosis based on their particular symptoms, then I will refer to a gynecologist who specializes in endometriosis.
Mhm.
And
Mhm.
same thing, like if I feel like they have maybe a vascular condition, I will refer that to usually like an interventional radiologist to do a vascular procedure. And then I treat things like interstitial cystitis, vestibulodynia, and both the provoked hormonal and neuroproliferative vestibulodynia.
Mhm.
So
Yeah.
I think it's really important to have a lot of people on your team so we can all talk about these the possibilities, like what is the possible differential diagnosis for the patient, and offer them the treatment that is correct for them.
Yeah, because we get a lot of referral from the like urogynecology. I mean, like
Mm,
yeah, gynecologist, and then they have all those interstitial cystitis, and then all those pelvic floor pains, and then more like a team approach. I think absolutely
yeah.
helped, I think, a patient's quality of life. So let's go back to more like a sexual health. And also, I learn a lot. People saying if you have a better sex, it's a better good for your brain. And like they said that it's something talking about even dementia and said like, oh,
Yeah.
so is that true? And then can you give a little bit of a more like insights about what how this relate to your brain? And it kind of makes sense though.
Yeah, I think there's many layers about that too. I think certainly when we have more relationships and healthy relationships, social relationships, that decreases our. Um, oh, can you still hear me?
Yes, I can hear you very well.
Oh, sorry. I can start again. My screen went black.
Okay.
Okay,
It's a
sorry.
fine though in my end.
Okay. Um, So I think there are many aspects to this, many layers to this. When someone has a good social relationships, um, that decreases, their risk for dementia.
Mhm.
And I think also sex itself, our intimate relationships are some of the most critical relationships. They play the most important role in our lives. So I think that is really important just from a relationship aspect. And then sex itself, of course, it releases like all the dopamine, you have serotonin, you're happy, oxytocin, it's creating these neurotransmitters in your brain that are probably stimulating. I don't know exactly the science about how it decreases dementia specifically, but I know that there are some studies looking at for both men and women how having more sex is beneficial for mental health.
How about a longevity? if people having better
Longevity.
sex, they live longer. Because everybody now
Yeah.
talking about how to live longer, and then like I thought about this. It's kind of interesting. Is there any study or anything to share about the sex actually contributing for people to live longer?
I think I know there are some studies in men. I'm not sure if there are enough studies um, directly about women. Um, do you know of any? I actually don't think I know of any off the top of my head.
No, actually, I don't. I
Yeah.
thought that some people said that if you're not married, then you live longer. So
Oh yeah,
it's
actually
it's a
I do.
different than sexual health, but I thought that
Yeah.
interesting. So can you say like let's go to the more like a treatment wise? Because
Yeah.
there is a new drug for, I think, a woman's now, and then
Hmm.
maybe I want to hear about that. Also, we also discuss about the men, because there's a men, like there's a lot of drugs out there already, and then we know, but
Hmm.
is there anything new things happening in the sexual health world?
Hmm. So there's three main things. One is hormonal treatments, just broadly hormonal treatments, so testosterone, estrogen, progesterone. And then there's the non-hormonal treatments, and of course, these are in America, the two FDA-approved medications for improving libido in women. Um, and the two non-hormonal treatments are Addyi, flibanserin, and then Vyleesi, bremelanotide. And both of those medications were originally only approved, FDA approved for postmenopausal women, but actually, Addyi recently received approval for premenopausal women as well. Because actually, the patients with HSDD or hypoactive sexual desire disorder, like low libido, many patients are actually younger. So it's not necessarily related to their hormonal state like menopause. It may be related to just their neurotransmitters. So the chemicals in their brain. So that is what those medications are directed towards. They actually change your neurotransmitters, the levels of like dopamine, gabapentin, serotonin in the different places inside your brain that are responsible for sexual drive. Um, so it doesn't matter if you're premenopausal, perimenopausal, postmenopausal, the those neurotransmitters in your brain, they're the same ones, right?
Hmm.
So the premenopausal woman, as well as actually men, benefit from these medications the same as, postmenopausal women.
So we use that for both men and women.
Hmm. Yeah.
Wow, that's I mean, because I'm hearing a lot from the men complaining about female, like a low libido, like a husband's asking a lot.
Ah,
But I also see a lot of men having some problem with the all other complex, the chronic health disease, like
yeah.
for example, like a diabetes, and then I mean we have a lot of medication, but I didn't notice none that there's even more hormones out. I mean more medications out there.
Yeah.
So what is it? I'm curious about your approach. So you have a patient coming with these challenges. Are you tended to more prescribing medication, or are you also implementing more holistic approach in your treatment plan? Because I know you're a yoga teacher. You teach people yoga in the
Yeah.
park.
I absolutely believe in a very holistic approach, because it's not just one thing, right? It's like the body is both mind, spirit, and physical. So we have to address everything. And also, every person is different in how they best receive the treatment, right? So some people may respond better to a medication, or they would rather take a medication, and some people would rather talk to a therapist. I think the best result is when we use all of these therapies together. So I always recommend sex therapy, pelvic floor physical therapy, and then, if they want to try a medication, or something like that, then that's what I'm there for primarily, is as a doctor of medicine, to prescribe the medication, and if they need some kind of procedure, to do these procedures.
Yeah. Don't forget the acupuncture.
Yeah, and acupuncture,
Yes,
absolutely.
because it's
Yeah.
absolutely help the brain and then physical structure challenges and inflammation and then pain and then we see really significant improvement in our clinic for patients all different ages, not only hormone related. So I there's a lot of a misconception about this sexual medicine or sexual health. Is there one thing or something you want to share with the people? Like people probably want you to know about is what is a sexual health and then sexual medicine is.
Yeah. I think the biggest thing, even now that we struggle with, is that women's sexual health is important. You know, we have so much focus on men's sexual health, and women's sexual health is still like some people, especially our older patients, they even forget about it themselves. They think, "Oh, I don't need that anymore," or, "That's way behind me. I'm postmenopause, like I don't need to think about that anymore." And of course, it's each person's their choice. But I think, like we've talked about, there are many physical benefits to healthy sexual health. And there's psychological benefits, mental health benefits, and then there's also like a part of you that it's like your inner like self that maybe you forgot when you went through menopause or left your sex life behind. And so when we see patients regaining that, it's like you see a spark light up in them again, and they forgot what that spark was, and then they have it again, and it's like bringing new life. um, so I think just even that it's important is one of the biggest things.
Oh my, I love this. So what you're saying is when people get older and then we accept that, okay, no more sex because I am like let's say like 70 years old. But what you're saying is no. Actually, you can keep continue. Is that what I'm hearing?
Yeah. Yeah, I think it keeps people youthful, actually,
Mm-hmm.
So because people have that vitality, that spirit that keeps them youthful, it keeps them playful. Sex is kind of like adult play. So having that in your life, I feel like is something that keeps people healthy overall. Yeah.
Wow. I mean, now I can tell the man is very happy to hear about this, especially husband. Okay.
Yeah.
So it is such a lovely talk, and I learned a lot from your talk, and then thank you so much. And